I think what's most important to understand about 9/11 was that the type of exposure that these responders underwent was really very complex. And so if you start from that perspective of what actually occurred on 9/11, where these planes hit these buildings, they dispersed a tremendous amount of jet fuel. There was a tremendous amount of burning of this fuel, a tremendous amount of heat that occurred. And as a result of the fire itself, there was a burning of all the plastic and all the electronics and everything of that sort. And then what happened was that the buildings collapsed. And as a result of that collapse, there was this total pulverization of these structures with a tremendous release of dust and materials into the air, which included burning plastics and fluorescent bulbs and computers and all sorts of toxic material, which even if today, if you wanted to put any of that stuff into a landfill, you would have to go into and have them segregated and placed in a very secure way. So this was all in the environment. And then on top of that, there was a tremendous amount of human destruction. 3,000 people died. But there weren't any bodies, really. There were only fragmented bodies, people jumping from buildings, fragmentation of the body where there was a lot of body parts. And as a result of that, there was a tremendous amount of psychic trauma as well. And all of these things went on over a protracted period of time. So it was a rapid succession of toxic events that occurred over a prolonged and protracted period of time. So you begin to understand the complex exposure that these people underwent. You begin to understand that they're going to have both psychological as well as medical illnesses. They had both physical and psychic traumas that occurred concurrently. And so initially, immediately afterwards, we began to see a variety of respiratory problems, asthma, coughing, destruction of the lung, sinus disease. And all of this was caused because there was a tremendous amount of caustic material that these people inhaled. And at the same time, there was a tremendous amount of psychic trauma. There was a lot of post-traumatic stress disorder, a lot of anxiety disorder, a lot of depression. And what our research is most interested in is how these two realms interact with one another. How does the psychic trauma impact the physical trauma? And how does the physical trauma impact the psychic trauma? In our clinic, we believe that the mental health and the physical disease are intimately related to one another, and that you're not going to overcome a lot of the problems, or at least to improve the level of functionality, where people are back to where they were functionally, even though they may still have disease manifestations, unless you attack both of those entities simultaneously. Well, most common, of course, is the respiratory, both upper and lower respiratory. And what we mean by upper respiratory are diseases such as sinus disease, upper airway in the throat and the larynx. And then we have lower respiratory disease, such as asthma, reactive airway disease, and diseases which have directly impacted and scarred the lung itself. And then the other aspect is we see a lot of gastrointestinal disease, a lot of upper gastrointestinal disease in the stomach and the esophagus. And all of those is really, when you think about it, when these people were down in 9/11, there was a tremendous amount of dust in the air, and this dust was extremely caustic. They had a very high pH, just the same pH as what you would expect to see in soap. So imagine putting soap down your throat or into your lungs or into your nose. You can imagine that tremendous amount of inflammation and scarring, and then over a prolonged period of time, it's even greater. Well, when we see rare conditions at this point, we don't say that they're necessarily World Trade Center related. But one area that has been shown to be World Trade Center related is a disease called sarcoid. This is a relatively rare disease, and we're seeing it with very increased frequency. And it's an immunological disorder. It's a dysregulation of the immune system that gives you areas of inflammation and abnormalities in the lung or in other tissues. And so we're seeing that with good frequency. Well, there are two things that you really want to know. One is that our program is a monitoring program. We're looking for the onset of new diseases that are related to 9/11. 9/11 was a unique event. We don't know what will transpire as a result of it. And so we have to continue to monitor very large populations of patients. We follow 5,000 patients on Long Island, looking for new diseases that might be related to 9/11. And that could be anything from immunological diseases to cancers to other types of respiratory and gastrointestinal disease. So that's one aspect, the new disease. The other aspect is it's now 10 years after 9/11. And there are patients that continue to suffer from diseases which began manifesting themselves right after 9/11. So what we're very interested in now is, how do we overcome those problems? How do we deal with a lot of the psychic injury that continues to plague these people? And the respiratory disease that causes a tremendous amount of dysfunction. So there are two parts. One is what began a long time ago and how do we improve that? And two, what's going to happen next? I think we've been doing a very good job. I think we have a very high level of the patients are very satisfied. I think that more money is going to be required to do research to be able to overcome some of these problems that I'm describing. I think what we've now done is we've been able to identify a whole host of issues. I think we've also been able to say that they're very unique in many ways to what has been previously been described for these particular problems. Now we have to kind of understand why are they occurring in the way that they do. And by that fundamental understanding, how do we develop therapies to overcome them?